Hi, Dr. Peter Montgomery, family practice doctor here to share again another COVID update with you. It is Tuesday, April the 7th, and things are starting to turn. I'm going to talk a bit about that. Still reaching peak fever happened a few weeks ago. We're getting to peak cases and peak hospitalization. And Europe is already starting to make the turn. Uh, Spain and Italy, the two hardest hit countries, are having less cases and actually less people dying per day now. It is still very bad in the New York, New Jersey, Connecticut, Pennsylvania area, and even Rhode Island. But they should hit their peak soon. And I have some modeling websites I found that'll help share that with you. So things are starting to turn. I'm trying to be positive, but not Pollyanna here about this. In my local area, I'm in the St. Louis area. We're doing very well. We're preparing for our level of surge over the next week or two. The group I work with, has been very proactive, and I think we are in a good position. It will be very tough. Bad things are going to happen still, despite good efforts, good preparation, and good planning. But I think we're in a better situation than we thought we'd be a month ago. So the social distancing is working. The numbers are looking improving. Better than projections were in January. Projections were horrible, like 500,000 Americans dead. Look at some of the projections that we may be at the under 100,000, because everybody's been doing a fantastic job with the social distancing, the washing, the waving, the wiping, and we need to keep up with it, as difficult it is emotionally, physical, psychologically, and financially. It is saving tens of thousands, hundreds of thousands of lives. So everybody's doing their part. So let me get on to showing you where we're at now, and we'll go from there. So here we are with the Johns Hopkins uh, map of the cases in the world. 1.4 million confirmed cases, and 82,000 deaths. Even though that's very sad, the positive turn is that we have 3 days of data in the world that are below the peak. The peak on the 3rd of confirmed cases. So that is actually starting to make a turn. And looking at it logarithmically, we can see that there's a bend there. It's starting to turn a bit. So that turn is very positive. In countries like Spain, the turn happened more, and the peak, as you can tell, happened over a week ago in the number of cases. Italy, same thing. Peak cases here on the 20th. And here we are 2 weeks later, continuing to go down, finally hitting a decrease in the peak death per day. So about 10 days to 2 weeks from peak cases to peak people dying. And that's in the worst case scenario, where those countries are hit the worst. The U.S., like I said, we got 3 days below peak. Um, so we can probably see, depending on where you live, what part of the country, a peak people dying per day rate happening in about 7 to 10 days, and then improving from there. I know that sounds very morbid to say it that way, but that's how things are going. Uh, it seemed to also hit Southern Europe and then Western Europe hard, and then moving eastward. And Russia, sadly, the numbers are picking up in Russia in a steady rate, logarithmic. That's a pretty straight line. And then just about a week or two of that straight line before things turn. And India, um, is the second largest, soon to be the largest country in the world, a very straight line as the number of daily increases. The math here, looks like they have an inconsistent reporting. Logarithmically, that smooths all that out and says, no, that's a real straight line. That's heading straight up still. Right next door, Pakistan, also a very straight line, not as steep, but still as straight as the number of cases are going up. And pray for that part of the world as things continue to get worse. U.S., as far as tracking the cases, we're still doing over 100,000 tests um, a day as a physician. It's been very frustrating not being able to test all the patients I want to test. I would like to give people comfort that they don't have it, and give people comfort that, hey, we're on it, that you do have it. And But we don't have enough tests. We are having to ration them, and I'm cringing at that thought of having to do that, but that's what we have to do. And the treatment. I wish we had better studies confirming medicines. I think that would have a good reason, but I don't have solid data, so we're having to judiciously use the best medicine that we know of, um, and uh, and that's really difficult. You hear me stammering here. It's just really hard to be in this situation. I wish the powers that be, the people who did the research, the people that paid for the research, we had decade or more. SARS 1 came around 2000, 2004. Apparently, they thought it all went away. MERS came along, another coronavirus, and again, over an extended period of time was actually even more fatal per case. And again, not enough resources are thrown at it. So that's my rant at the machine. We really can't blame any one person or any one country. This was system wide. Okay, rant over. Back at the U.S. weather map, again, the observed temperatures, we are cooling off. Actually, that was yesterday's. I'll hit the refresh button. And here's today. Still, New York is the worst, but overall, their numbers are really low because they're doing their best to socially isolate. Looking at the atypical, where is it higher than it normally is for this time of year? Manhattan, Kings, Queens, Staten Island, the Bronx, they're all still way above average. Whole New Jersey uh, into New York area, into Pennsylvania, Philadelphia, Pennsylvania there, uh, and Connecticut, Rhode Island, and into Boston, Massachusetts area. It seems to calm down by as it goes up the seaboard, but still, that's pretty much the worst part of the country temperature wise. Florida, a lot higher red, but the cases don't seem to be as bad there. Louisiana, it's not as high on the weather map, but they've been having very high death rate per capita there. Seems to be overwhelming the system there. This is the worldometer that gives a measurement. Again, a morbid way of measuring the numbers, but it's the most accurate way to go about it, which is death per million here. Let me turn off the swimsuit ad. So the very small pocket country of San Marino, which is completely surrounded by the rest of Italy, has had very bad per population. But for a large country, Spain has surpassed Italy, France, Belgium, Netherlands, that whole western part of Europe has had it very bad. Switzerland between Germany and Italy, Sweden because they intentionally did not do any social isolating per government order. USA um, doing here a bit better than the UK, about half as many cases or so. Germany doing a very good job. And like I said, as you go eastern through Europe, Poland, and into Russia, it's even less. I just think it's getting slower to Poland and Russia, but I can tell they are picking up in cases. So we hope that they'll have learned from what we've learned from and be prepared for it. And how do you be prepared for it? That's the second part I want to get into. University of Washington has a project where they've been doing their best to help people predict peaks of utilization and mathematical modeling. Here's the United States mathematical model. Um, the number back here is actual cases and then predicted, worst case scenario, best case scenarios, but mathematically most likely the way it'll go. And also by hospital beds, ICU beds, and how many ventilators we're going to need. So looking at the US, how many hospital beds we have, how many ICU beds do we have? These are numbers we didn't know we knew. But the specialists and the people who this is their career, they did know. We're about 36,000 beds short of what we need and 16,000 ICU beds. But it seems to be mainly in the New York, New Jersey, Philadelphia, Connecticut, Rhode Island, up into Massachusetts area, and you can break it down by state even. I'll go on that data. But here's the total death rate. At one point, early projections were as high as 500,000 if we did nothing. And efforts were made, and we it is going to be 80,000, under 100,000. A normal flu season is 30 to 50,000. One of the worst flu seasons on record was 100,000. 2008, 2009 flu season was really bad when H1N1 came through. I remember a certain level of panic back then, and in our area, and extra hospital tents out in the parking lot to triage patients, and a similar thing that we're doing now. Uh, Worst case scenario, this is for the nation, under 140,000. I would still consider a significant effort that everybody has undertaken to achieve that. National peak, tax day, April 15th, and then coming down from there, sadly, is on peak day, April 15th, is not peak bad news day. Go to April 15th, we'll still be at less than half of the projected deaths at peak utilization day. Sadly, the lagging of people dying from the disease lags about a month, as some people get it later and some people show up later. So we got to keep on the ball for a good solid month here. But it does show June 1st being when it dramatically seems to drop off, and hopefully we avoid a second wave. Hopefully we stick with this and stay through this and get through to June 1st. So I'm, with looking at models like this, May 1st, big improvement, big drop off the steep part, and June 1st before we really think we've got this under control, but it looks like it is going to be with us and something to keep an eye on and try and prevent future waves. We can break it down by state here, going into here, and to look at New York, New Jersey. And also they have on here what date different states did things. March 18th, educational schools were closed. March 20th, non-essential services were closed. March 22, stay-at-home order was issued. And you can kind of look at the peak on here. So about when were those things done? Way back here early before it really got going, those things were done. And peak in New York should be tomorrow, April 8th. But sadly, that means, it doesn't mean peak people dying, but New York looks like they're going to head, it's New York State, not just the city. 15,000. The 36 hospital beds short, a third of those are in New York State. Of the 16,000 ICU beds short, a third of those there in New York State. So they got hit the hardest. Looking into New Jersey, again, another chunk of the probably, again, New York, New Jersey, it's about 2/3 of our overwhelming. The line here is the number of hospital beds in New Jersey and how much they exceed that. And projected deaths and stuff and the peaks there again. So very similar pattern. Each state has a slightly different peak. New Jersey's not going to peak for another week after New York. You can go on this website. The header is up here, healthdata.org. And you can go to the University of Washington site and click in and look at your particular area or your state of concern. I live in Missouri. We're a smaller state, but we have more beds than we are going to hit with the peak, so we won't have a bed shortage. We're not going to have an ICU shortage, and we have enough ventilators here in Missouri. We have, educational facilities closed 23rd, stay-at-home order on April 6th. We have not shut down all non-essential things, it looks like, because we're going to be able to handle the wave Every bit we do, though, does cut down on people dying. The largest state in the nation, California here, they have excess beds. They've got enough. It looks like they're going to be all right. And if you look at ICU beds, they're going to have enough. Click on that. Even assuming worst case scenario, and they have enough ventilators. Matter of fact, they actually were donating extra ventilators they have to nearby states, and for the national pool, we're sharing resources. So you can look on this, look at your state, see how well they've done preparing. You can see what how the states that implemented these things a few days sooner seem to be better. California went on about 3 days sooner than the rest of the nation, and by looking at the weather map, they've kept it cooler than other parts of the country that did it later or didn't do anything at all. So let's keep at it. Everybody doing the best they can. We are turning the corner on fevers. We've already turned the corner on fevers. We're turning the corner on peak cases soon. The healthcare system, we are working hard and we are keeping up with the projected surge, having the hardest time up in this sector here, Florida, Louisiana, and Detroit. Um, uh, are working the best they can. They are exceeding their needs, but everybody's trying to share with their excess that they have. And let's hang in there, and I'll give you another update tomorrow. Thank you very much.